Hello, my name is Chevy Miller. I'm a registered nurse. Did you know that each year there's between 700,000 to a million people in the United States that experience a fall while being in the hospital, or nearly one-third of these falls can be prevented? This was told to us by research that was performed by Dr. Gans and his associates at the Agency of Healthcare Research and Quality. If you work at bedside as a healthcare professional, patient falls are a common discussion that we come across quite frequently. It's normally one of the big things that state focuses on when they visit the hospital too. So I've been in a healthcare setting for 7 years now. I worked as a STNA, which is a state tested nurse's aide. I also was a licensed practical nurse, and now I'm a registered nurse. So I have found that there are often fall protocols, but they don't change between the settings that I've been in between and also the type of acuity for patients too. Whether this is a part of your professional, this is a part of just helping prevent someone from injury that you care about, it's very important to understand these skills and to make sure that these tasks are completed when we're preventing patient falls or family member falls. There are 3 basic methods that we use within the hospital setting or in any type of inpatient setting. So a crucial method is making sure that the patient is wearing shoes or non-slip socks. This ensures proper friction between the floor and the patient's stability. Another way to prevent falls is to ensure you have the appropriate ambulation device for a safe transfer or ambulation. With that can be such as a walker, a cane, a gait belt, a Hoyer lift, which that requires 2 people, and then making sure you can use the sit to stand also, which those are very neat. Sometimes they are hard to find in settings. Another way to prevent patient falls is to ensure an appropriate environment, such as making sure there's adequate lighting, clutter-free space, making sure you have the appropriate amount of staff with you. And so environmental safety is a huge factor at preventing falls. Making sure there's nothing, no rugs on the floor, that's very important for a home setting too. Come in with broken hips and things. From my past job, I worked on an ortho med surg floor, and so patients would come in, they had tripped in their kitchen, and normally the cause of that is because of a rug. It's important to have a fall prevention program or a fall plan in place for our loved ones or for our patients. In conclusion, in my experience, I found 3 methods very effective in preventing falls that can help reduce injuries and the overall number of falls within patients. With this knowledge, I hope that you're able to use these tips to help prevent injuries to your loved ones or to patients. Thank you, and I hope that this was helpful.